So my name is Justin Kammo. I'm an orthodontist here in Metro Detroit. I always liked the field of dentistry just because as a kid I always had a traumatic dental experience, so I was always at the dental office. Once I got old enough to have braces, I had the whole 9 yards with a face mask, 5 years of braces. And I enjoyed going to the office. It was never like an unpleasant visit. I think a lot of kids enjoy going to the orthodontist because there's just no pain. There's always cool things going on at the orthodontist office, either, the music, the games, like the food, the whole environment of the office. So I always saw everyone having a good time. So when I got older, I knew I wanted to do something in the medical field. And then when I had the options of, going to become a physician or a dentist or a pharmacist, just dentistry stuck out because of all those past childhood memories. And then once you got to dental school, then you get to pick your specialty. And, orthodontics was definitely at the top of my list after going through what I have done and knowing that people are happy when they come to the office. So to be a dentist, you have to go 4 years of undergrad and then complete 4 years of dental school. To become an orthodontist, you have to be selected top of your class. And once you get selected, you got to complete a 2 to 3 years master's program to become an orthodontist. I went to the University of Michigan in Ann Arbor for dental school. Once we completed the 4 years there, I went to do my orthodontic residency at the University of Detroit Mercy. After graduating as an orthodontist, I still continue with a lot of continuing education. I'm a diamond provider for Invisalign, meaning I'm top 1% in Invisalign's company. And I always like to stay up to date with the latest technology in braces, such as like indirect bonding, where, we're digitally planning braces and we're placing them on a computer, and that way we get the best quality for our patients. The best thing about being an orthodontist is seeing the kids transform over the 2 years. You see them as a young kid and then become a teenager, and then you also get to see them go from a crooked smile to a great smile. And you can see the emotion in them, and you can just build those relationships. And then you see them as a young kid and you see them grow as an adult because, sometimes they get older, they bring their friends, some become older enough where they bring their future kids. So it's always great to have that connection and treating legacies of families.